As of Thursday, there were 99 hospitalized COVID-19 infected persons, 73 of whom are being housed at the Liliendal COVID-19 hospital, the minister said.
Of all these patients that we have, of the 73 patients that we have at Ocean View, we now have 23 persons in the ICU. So it is a serious thing, and I really hope that we can get people to adhere more strictly to the measures.
Since the beginning of the COVID-19 pandemic in March 2020, the measures implemented to keep citizens safe have been the wearing of masks, sanitizing, and social distancing. These measures, the minister noted, are simple, yet persons fail to effectively adhere to them.
Some people, they do the measures, but they do them in a very sporadic manner. That doesn't work. If you're going to do them, you have to do it consistently. So when you're in a room, when you're in the public, you have to wear your mask consistently. Some people would have on a mask, they have it under the nose. If you're not protecting your nose, then you can get infected.
Given the recent availability of COVID-19 vaccines, vaccination has become one of the key ways identified by health officials to lower the chances of a person contracting and or dying from COVID-19. It was reiterated that vaccination is the answer to ending the pandemic that has killed millions of people worldwide.
If you didn't get a first dose by now, please come. There's still first dose available. Come to one of our sites, you can get that first dose. And if you have taken a first dose and you need a second dose, that is available as well.
At present, there are 306,906 persons, or 59.9% of the adult population, receiving a first dose of a COVID-19 vaccine. 158,557 persons, or 30.9% of the adult population, is now fully immunized. While there has been a continuous uptick in vaccination, it was conveyed that the country has a far way to go to achieve herd immunity. On Thursday, it was reported by the Ministry of Health of Trinidad and Tobago that the 4th and 5th cases of the dreaded Delta variant in the country came from people who returned to Trinidad from the United States and Guyana, respectively. The ministry said that despite bringing in negative PCR tests which were taken 3 days prior to their arrival, due to Trinidad and Tobago's quarantine protocols, they were tested a second time, and after the positive results were received, they were taken to a step-down facility to recover. This means that these cases were likely unvaccinated individuals. The presence of the Delta variant was confirmed via gene sequencing at the laboratory of the Faculty of Medical Sciences, University of the West Indies. Research has suggested that the Delta variant is more easily spread from person to person as compared to previous variants, estimated to be 2 to 4 times more transmissible than the original Wuhan lineage of the virus. Additionally, evidence indicates that individuals who have contracted this variant may be prone to an increased risk of severe illness and hospitalization. This variant may also lead to an increase in cases of COVID-19 in younger age groups and in those who have been previously infected. Reporting for the HGP 90 News, Kendell Richmond.